The university have its core mandates, and these core mandates are teaching and learning, research, community service, and entrepreneurship. The Putor Center has contributed significantly in all these areas of the university mandate.
The center was established in November 2018, so it's one of 10 ACE centers, then called new centers, that were established in Nigeria. ACE Putor was born out of a great need, within the environment we operate. And this was because of the challenges related to public health and the fact that we're in the Niger Delta area of Nigeria, which is part of the Gulf of Guinea, and there are a lot of oil exploration and exploitation, that with the consequence of affecting people's livelihood, and public health. So ACE Putor is actually a nexus between the public health and then the toxicological effect or environmental health effect, of human activities.
Today, Putor produces postgraduate students, masters and PhD students who can hold sway everywhere in the world.
The Africa Center of Excellence in Public Health and Toxicology Research, ACE Putor, has achieved remarkable milestones since its inception in 2019, training a total of 1,771 masters and PhD students. Among them, 524 are pursuing PhDs, while 1,247 are master students. Regional students constitute 213 of the total enrollment, and over 1,000 are females, highlighting the center's commitment to gender inclusivity. ACE Putor offers an array of PhD programs in environmental toxicology, environmental health, nutritional biochemistry and toxicology, and public health. At the master's level, the center offers programs in midwifery and health nursing, public health, petroleum and toxicology, and fertility nursing.
We have had our collection from countries like Ghana, like Uganda, Kenya, even Sierra Leone and Liberia.
Our mission was to be a one-stop station, to congregate highly skilled manpower, that will be able to conduct research, train local capacity, in the area of public health, toxicology, and as a means of national intervention, build the nursing capacity in this region.
With a mission to congregate highly skilled human resources within and beyond the University of Port Harcourt, ACE Putor has successfully forged strategic partnerships with notable organizations, including the Shell Petroleum Development Company in Nigeria, within its community health sector.
For us, partnership is very key, and that's where ACE Putor comes in. So we've worked with ACE Putor for the last 5 years. They are, for us, one of the most critical academic organizations that are churning out human capital, human capacity, resources, to begin to transform the healthcare system, especially from a resource-limited setting like ours, where we can get the right people to do the right thing for healthcare, to begin to change the needle for healthcare for our nation.
Putor, as one of these World Bank centers, is doing tremendously well in terms of research output. They have produced papers that are published in very high quality journals all over the world. They have produced results from researches that are used widely all over the place. And most importantly, Putor provides facilities, state-of-the-art facilities, some of which we don't have even on this side of the university. And these facilities are there for all students of the university to use. Whether you're a student in Putor or not, these facilities are available.
Beyond its degree programs, ACE Putor has delivered professional short courses to approximately 1,000 health professionals. These courses cover essential areas such as grant writing, intellectual property, and technology transfer, further enhancing the skill set of participants.
of my being in this center, I've been privileged to associate with research experts in different fields, particularly as a midwife. I was privileged to be under the mentorship and guidance of the first professor of midwifery in Nigeria, and it's a privilege for me. I think that's one of the benefits. Secondly, the center has afforded me the opportunity to carry out my PhD under less pressure by virtue of the hybrid learning they provide, unlike other regular programs. The pressure on my family as a wife, mother, and a midwife has been less because of the flexibility of the learning experience here.
My experience in Putor was a very beautiful experience. First of all, we had regional students from different countries and were able to interact with them. So one of the experiences that we're able to unify, irrespective of our different geographical location, we're able to come together to learn under one environment. We also have lecturers from different fields of study, different faculties coming together to teach us. So it was like an interdisciplinary learning and experience from different lecturers from Faculty of Science, Management, Clinical Science.
My second supervisor, she's a professor in nutritional toxicology. And imagine a midwife collaborating with a toxicologist. It has further enhanced my research skill and then broadened my research perspective as well.
The center's facilities include 4 state-of-art laboratories: the nursing skill laboratory, the clinical simulation laboratory, the public health skills laboratory, and the biochemistry or toxicology laboratory, as well as an animal house for clinical trials. It also boasts smart lecture halls with sitting capacity of 42, 72, and 102 students. ACE Putor is also constructing an innovation hub and a 24-room guest house for alternative source of income to support its activities.
University of Port Harcourt has got a favorable policy that allows us to engage and interact with the wider academic community globally, and that is why we can pull out faculties from anywhere in the world, as well as students, and merge them together while we provide coordination, for their research and so on. So we've got that wide landscape, and we've made partners across the globe.
My research work actually focuses on the issue of postpartum depression. But the interesting thing about it is that it's focused on paternal postpartum depression. And the problem it's trying to solve is the mental health problem of depression in general. And in that research work, I tried to x-ray the knowledge of midwives, nurses and midwives, regarding this issue of father's postpartum depression. Because what is really known before then was mostly maternal postpartum depression. Little attention was paid to father's postpartum depression.
You recall, during our accreditation program with the process with the RSB, it was very tedious, but then, we learned a lot in terms of, developing programs with respect to international standards. And that has also helped, not just for the center, but also for the university in general. And it has actually shaped, the curriculum we have. And we can boast that with the coming of ACE Putor, it has really helped the entire university to, have a better curriculum in terms of delivery and all that.
Students at ACE Putor enjoy a wealth of opportunities, including access to cutting-edge facilities, world-class equipment, and a robust network of peers and mentors.
One of the things I've also noticed about ACE Putor is that they are pulling together relevant courses, not just any course, because there are a lot of courses that are happening maybe in our key institutions now that are not relevant. Key healthcare courses that are needed for the industry, that are needed at national and subnational levels, they are bringing to the table. So for me, I must really commend the leadership of ACE Putor from the conception of ACE at all to ACE Putor itself in Port Harcourt. especially the leadership, the commitment that I've seen from them, the fact that they have been intentional to make sure that the industry and partners are working with them for ultimately all-round excellence of healthcare in our nation.
The center's flexible programs and high-quality faculty contribute significantly to a rich educational experience. The impact of ACE Putor extends far beyond the academic, influencing industry practices and benefiting the broader community.
Community service is defined for us here as our ability to touch the community we serve. This community could be the University of Putor community or the host communities. And one key thing Putor is doing, it has helped us in developing capacity. When we do programs, conferences, workshops that we invite and train staff of the university and improve their capacity, of course, that's very impactful on the university. And Putor is noted for doing many of those kind of training to upgrade knowledge and capacity of staff of the university.
For us in Rivers State Primary Healthcare Management Board, we are a partner to Putor because a lot of the students come to do some form of internship, either the nursing, people doing masters in midwifery, or that are also doing public health. This is a public health institution, so you find out that they will post them to our various facilities, both in the urban and the rural areas. And within the period, of course, they learn primary health care. Primary health care is about community health. When you come to primary health care, you're like a member of that particular community, because we have what we call the Ward Development Committee that has the chiefs, the religious leaders, and all that, market women as part of the Ward Development Committee. And this group of people take care of the PHCs that are in their wards.
Since 2017, I become the youth president of Omoko. You know, the primary health center has some little challenges they do, because when you go there, you find that some pregnant women doesn't attend to that place because of the bad road and because of the electricity and because of there is no doctors there. But the community find out that since the ACE Putor come in, we can see community free treatment. We can see other cough, malaria, and other things. They always attend to the community. Whenever you go to the hospital, you find a doctor. Whenever you go there, you see people that will attend to you immediately the way it is to you. So the community becomes so much happy that there is a change. The first time, the community thought that is maybe because of the MD or whatever, but we'll find out that is ACE Putor that is involved or attached with them. That makes the change is marvelous in that environment.
Everybody is now involved. The academia from ACE Putor is involved. The private is involved as the industry. The public is involved. They are driving it into the communities. And you see, when all these groups, especially the community, take ownership, when they are in the driver's seat of their development, there's nothing that you cannot achieve.
Recognizing the importance of sustaining these achievements, the center is actively pursuing sustainability measures to ensure its initiatives continue to thrive beyond the initial funding of the World Bank.
Now, as a center of excellence, we have developed revenue streams. We've identified specifically 8 revenue streams, that will guide this plan. From the traditional fees, that we charge, which runs to roughly about 70 to 80 million every year, to the issues around patent generation and so on, to administrative charges, which we are beginning to introduce, and then we are also setting up cottage industries. We are focusing on issues around fluid and gases for laboratory. We've acquired the site and we've drawn the plan, to set up these industries. And from the startup from our students, which will come up once we finish our incubation lab, we hope to generate a lot of revenues as well. So we've mapped out all our expenses and what we intend to generate. And we think we're in a very favorable position as of now.
There are very many things Putor is doing. Putor is trying to bring up a consultancy consortium that will be able to do things that can bring money to the center when World Bank funding ends. That consortium will do a lot of things in terms of consultancy, service provision, and so on. And I expect that it will be able to raise money. Secondly, Putor is running fantastic postgraduate programs. Postgraduate, masters, PhDs, that will sell themselves. Because those programs are timely delivered, they're of high quality, which means subscription will continue to increase. And so even at the end of World Bank funding, subscription of those programs will continue to increase. And when people subscribe to a program, of course, they will pay the necessary fees, and those will sustain the center and the programs. And don't forget, all the core things you need, all the core facilities you need to be put in place has already been put in place by the World Bank. Fantastic offices, fantastic laboratory, fantastic equipment, fantastic, whatever you want is there. And so it will not be difficult to sustain that center even when World Bank funding ends.
For potential students, I will tell them that, first of all, it's a very good place to be for you to pursue your postgraduate studies. Should make efforts to start his or her research work on time and make sure that he or she put a timeline on each of the steps that are required for him or for her to be able to achieve his projects, his research work on time. Apart from that, the person should be more focused, to be open, to learning new things, be ready to unlearn and relearn, because this center is a place that will expose you to quite a number of things that will be very much beneficial to you.
The experiences in the Center of Excellence is an exceptional one, a beautiful one, and a one I would say is very commendable.